Health threats do not respect national borders. To avoid or contain their spread, prevention through vaccination is possible. However, for some infectious diseases, chemical and environmental threats, this is not possible. For this reason, early warning systems based on epidemiological surveillance and active search and verification of non-official information are crucial public health instruments. Moreover, in order to translate data into appropriate actions, the health detection of threats should be combined with the dissemination of information, capacity building, and a cross-border, harmonic and prompt response. Countries of the Mediterranean area have common sea borders in the remarkable ecosystem of the Mediterranean Sea. They form a recognized migration system and share common public health problems. In this context, addressing specific global and transregional threats, which may have an impact both on public health and on regional stability, is crucial. Appropriate capacity building and strong networking are proven to be effective in creating the needed conducive and capable environment. This is the spirit with which the EpiSouth network was established to implement, between 2006 and 2014, firstly the EpiSouth and consequently the EpiSouth Plus projects. The aim of the EpiSouth Plus project was to increase health security in the Mediterranean area and Southeast Europe by enhancing and strengthening preparedness to common health threats and biosecurity risks at national and regional levels in the framework of the International Health Regulations, IHR.
It's a really unique network which includes 27 countries from the 3 different regions, 3 different cultures. But the political not influence is on this networking. The people have built big trust, informal exchange on information, work together, learn together.
The EpiSouth network was coordinated since 2006 by a team of the Unit of Communicable Disease Epidemiology of the National Center for Epidemiology, Surveillance and Health Promotion of the Italian Institute of Public Health, ISS. The team was also in charge of disseminating the project outputs and of collaborating with the World Health Organization, WHO, on IHR-related research activities. The final EpiSouth conference was held at the ISS in Rome on the 20th and 21st of November 2013, with the aim to share and discuss with all stakeholders the project's achievements and challenges. The EpiSouth network was the biggest inter-country collaborative effort in the Mediterranean region, representing a unique experience and proof of concept that large-scale inter-country partnerships are feasible in the various domains of public health threat control.
On a acquis une nouvelle dimension en santé publique. Au départ, on travaillait sur la dimension nationale, la dimension régionale type MRO, donc méditerranéenne orientale. Mais avec EpiSouth, on a acquis une nouvelle dimension méditerranéenne qu'on n'avait pas auparavant. Et cette dimension permet l'échange de connaissances, d'expériences et d'améliorer nos compétences dans le pays.
Mainly, we achieved very good collaboration between the countries, between the colleagues in very good way, and this is very important. You know, for sometimes it is more effective than the official way to know somebody from directly the laboratory side, from the epidemiology unit, who you can trust, you can ask directly. Sometimes in any emergency situation, or if we want to share some knowledge, some troubles in our laboratory. Or
the EpiSouth Plus project contributed to the control of public health threats and other biosecurity risks in the Mediterranean region and Southeast Europe by focusing on 4 areas of intervention. The establishment of a Mediterranean regional laboratory network to facilitate common threat detection, the promotion of common procedures for generic preparedness and risk management, the development of a Mediterranean early warning and epidemic intelligence system, and the support of IHR implementation. A Mediterranean regional laboratory network was established to facilitate common threat detection and build regional capacity on the diagnosis of dengue and West Nile viruses and on biosecurity. This network was consolidated through trainings, site visits and an external quality assessment.
Le réseau de laboratoires est très important et très crucial pour faire la veille sanitaire d'une manière correcte. Ça permet d'améliorer les compétences, d'avoir plus de matériel pour les laboratoires de référence et c'est un appui important pour la veille sanitaire.
We could make some standardization between the laboratories. We could have the same terminology. Even it is very important. For example, for some commercial kits or something like that. In my laboratory, the simplest example, I changed the kits that I used until now after the EpiSouth lab training.
Building on the experience developed during the first EpiSouth project, EpiSouth Plus also aimed to enhance and strengthen preparedness to common health threats. Following a set of training modules and workshops, the capacity building process culminated in the implementation of the Nautilus simulation exercise and the preparation of the Emergency Preparedness Planning (EPREP) tool. The EPREP tool was aimed at supporting EpiSouth countries in developing national generic preparedness planning.
The objective of the Nautilus simulation exercise was at the first time to test the use and the availability of the national EPREP in countries, and second time to test the communication, coordination and decision making in alert situations. Also testing coordination between public health services and point of entries, and to see how the diagnosis confirmation procedure within the laboratory network is in the EpiSouth network. Also to see the timeliness of the process, and also to check the availability of stockpiles and front and outbreak response.
I didn't ever heard about other simulation exercise that brought so many countries in a geographic area that is we know that it's not an easy environment to work, and I invite you to publish.
Also, all the trainings and all the capacity building that was done during the EpiSouth project is something that will stay long after the EpiSouth itself. And also, I would like to stress the significance of the simulation exercise that was held in October 2013, because it was the unique opportunity for Montenegro to gather our national experts from different areas. And basically, that was the first time that we had the opportunity to sit along with Ministry of Internal Affairs, Office for Civil Protection, Ministry of Health, Sanitary Inspection, Institute of Public Health, and that was probably one of the most important added values of EpiSouth.
Enhancing early warning in the Mediterranean is essential to reinforce health security in the area. EpiSouth has worked since 2006 towards the creation of a culture of epidemic intelligence and towards the possibility of sharing confidential information among countries of the Mediterranean region. The focus of activities has been on epidemic intelligence, sharing of information, the publication of bulletins and thematic notes, and trainings on event-based surveillance. In order to facilitate information sharing, the EpiSouth network set up and facilitated a dedicated secure platform since late 2012 to ensure its sustainability and interoperability. This secure platform is hosted and managed by the European Centre for Disease Prevention and Control, ECDC.
Grâce à la formation réalisée avec EpiSouth, on va démarrer au Liban la veille sanitaire électronique au niveau national. Ça veut dire qu'il y aura un screening des sites internet sur tous les événements de santé pour détecter les alertes non détectées par les systèmes classiques.
we have opportunity for the first line to build our capacity. So also to share experience through the platform, or to use the very valuable information to the electronic weekly bulletins, which is very important for us as a country, to inform us as the professionals, but also the media. For instance, it was Olympic Games in China. We translate the whole thematic notes and put it on our website. So it's a unique opportunity to inform our people regarding that important issue.
During the pandemic flu, when EpiSouth provide us daily the situation of pandemic flu cases, not only in EU countries but non-EU countries, which is very important for us because we know at every moment what is the situation almost all over the world.
In order to increase health security in the Mediterranean area, it is necessary to enhance preparedness, detection and response capacity at national, regional levels to face threats to public health. The framework of the International Health Regulations, IHR, is particularly useful to this effect because it is not only legally binding for all EpiSouth partners, but it also declines a set of capacities to be met, detailing a mechanism for information exchange and response collaboration under the umbrella of WHO. WHO provided subject matter expert advice and enabled EpiSouth Plus to access regionally aggregated data collected through the WHO yearly monitoring of IHR implementation. EpiSouth Plus contributed to the development of knowledge in this area by conducting in 4 countries of the network the EpiSouth Plus National Situation Analysis on Coordination of Surveillance between Points of Entry and National Health Systems, also known as the ENSA. This study included site visits in each participating country, involving both the Ministries of Health and the points of entry. The ENSA was designed in close collaboration with WHO subject matter experts and implemented thanks to the strong commitment of the 4 participating countries. The ENSA was found to have a national added value for participating countries, and its results are being used to enrich the contents of the WHO global guidance.
And then we show some, or we want to show some examples of national surveillance systems that integrate point of entry. Some of the success stories that could be showcased in the guideline as examples. And this part is one of the main points where the EpiSouth work is going to contribute to this guideline, because as it was already explained, there were these visits to 4 countries with a good in-depth analysis of the situation that will allow us to use that information and integrate it in the guideline.
That this has been the occasion to agree common procedures, not only within the offices but also the other stakeholders.
And one thing EpiSouth did was, during the situation analysis, it gave us the opportunity to explain ourselves. I mean, I had to meet with my colleagues at the management of the air and seaports and explain what we do on a personal level. And I think this has enhanced our relationship, our working relationship after then. I mean, we communicate more freely, and I guess we understand each other more.
EpiSouth projects have a great impact in capacity building of the people, like lab staff or epidemiologists who are working in our countries, and also sharing experience and looking at the problem like the West Nile virus infection in the EpiSouth or Mediterranean and the Balkan region. We actually strengthen ourselves and implement in fully the surveillance on West Nile virus infection.
We hope that it will help to health sector to improve its level of preparedness in order to cope with all kind of hazard generating health consequences, not only biological threats, and the second, to have enough credibility to put pressure on other sectors to improve intersectoral collaboration for upgrading the generic national preparedness.
And it was a good chance to improve the tools for our generic preparedness plans and development, also to share the country's experience in capacity inventory and their plans.
And actually, because of this experience, we tried to do something like this in Italy. We tried to set up an experimental system for early warning, a national system.
As my role as project officer of EpiSouth, I think I would say I learn a lot. One of the things that maybe you don't realize is that for us, this is the first time as well that we work so many EU organizations in the same project. And for me it was very beneficial to learn to work with ECDC on specific issues related to EpiSouth, because it was not only on epidemiologic intelligence but as well on the laboratory component. We worked together on the training, because as well MedEpiet became a reality during the EpiSouth existence. And I would say that for me the major, result is EPREP, the tool that has been developed by EpiSouth, because I think it's quite good technically speaking, and I think this is in a very useful moment for us, because this is in line with the implementation of the Health Security Initiative, because we would like to support all the member states to develop generic preparedness planning, and this is worldwide, because this is in line as well with international health regulation.
The European Commission and the GDEFCO that I represent today has already chosen three paths to finance: the laboratory network, the field epidemiology training, and also the IHR implementation with WHO, with whom we signed a contract during the summer for points of entry.
When we started talking about EpiSouth Plus, we enforced very much the idea to emphasize the capacity development, the generic preparedness, the exercises. And we are very grateful for not only for having and being still delivering, but having also exceeded the expectations. I mean, the exercise was a real proof of how valuable that has been. Maybe not the cross-sectoral, because we know that's a very difficult issue, and for sure there's still much work ahead to cover in the sectoral, but at least the effort and the tries were put there to take it forward.
When speaking about EpiSouth, I must admit that we were a little bit skeptical at the beginning, because trying to put together representatives of more than 20 countries is not so easy, and from 3 different regions in WHO at the time seemed impossible, but now we see that it's possible. 7 years after, EpiSouth turned out to be more than just a network of professionals. It became a network of friends and colleagues, achieving a level of trust and cooperation that will be very hard to reach by any other network or project in due time. At the moment, we are thinking of adaptation of many other modules gained through this project, such as establishing of event-based surveillance system and regular periodic national simulation exercise. We are on the end of the project, but we are really start to doing something good, and I think we had to find a way to continue this process.
EpiSouth Plus is unique among projects funded by the EU and other international initiatives in this field, for its focus on the Mediterranean region as a whole. The approach, based on countries' expectations and regional needs, facilitated interest in participation. In addition to facilitating epidemiological communication and practical training, this regional approach strengthened solidarity and cohesion among all participating countries. This is particularly evident for information sharing regarding cross-border public health threats and the implementation of IHR, which have, among their challenges, that of interacting with national procedures and legislations and facilitating a common international action in case of need. Moreover, the adopted methodology enhanced co-ownership of participating countries by bringing together EU and non-EU countries in all the planned activities. While the collaboration of international institutions, the European Commission, ECDC and WHO allowed sharing of views while avoiding overlapping. Ultimately, EpiSouth Plus contributed to the stability of the region and improved public health protection.